Mr. Ahmad Mفتاح. He is a senior specialist in physiotherapy at King Abdulaziz Medical City, Ministry of National Guard. He's going to give us a talk on the role of physical therapy and preventing cognitive decline. Meanwhile, we will have a session at the end for question and answer where you can ask all the questions. تفضل.
Assalamu alaikum. Good afternoon. Good morning, everyone. I feel pleasure to be a part of Alzheimer Association speaker. Today we're gonna share with you some information about the physical therapy and Alzheimer disease. These are the outline and we'll go through in the presentation. The dementia is, as you know, that it's a broad term that refers to the progressive syndrome lead to decline in cognitive function, thinking, memory, orientation, learning, and affect most of the cognitive functions and also affect the mood, emotion, and behavior. It's interfere with ADL, and the consciousness is not affected with patient with Alzheimer. Dementia mainly affect older population, but this deterioration comes beyond the biological aging. In worldwide dementia, currently we have around 55 million and could be triple in 2050. As we're over 65 years old, it affects the women more than men, and Alzheimer's disease is contributed to 50 to 80% of dementia cases. As Dr. Najib showed that the distribution of the population aged with dementia among the world, it will be duplicated in all the world, especially in the Middle East and North Africa from 2019 to 2050. Alzheimer's disease is one of dementia diseases. It's a progressive brain neurodegenerative disorder that slowly destroys the memory, thinking, and affects simple tasks and activity of daily living. It's most common cause of the dementia, and it's sixth leading cause of mortality in US, and it's fifth of among the 65 years and older. It's not a normal aging, it's a deterioration in the nerve cells. And among the people or the age of 65 to 74, about 1.5 or 1.6%, which is increasing hugely in age group of 75 to 84 to about 20%. And after 85, it's become about 40% of patients being affected with Alzheimer's disease. As in population aged in Saudi Arabia, 65 years old, in 2007, we have about 2.8% of elderly people. In 2020, we have about double of the number of or percentage of people above 65, and it's estimated to be in 2030 about 8.5%. As a current life expectancy nowadays, we have a 74 years old, and the vision of the kingdom of 2030 to move forward to have life expectancy reaching 80 years. As you can see here in the pyramidal chart, that from 2015 to 2050, the population will going to be increasing and the elderly people. To understand the Alzheimer's disease, we have to go through the pathology, as in the left side, this is the normal synaptic neurotransmission that transfer the feelings, sense, and everything. And by the time amyloid beta become start to accumulate in the synapse and bind together to have the amyloid plaques, and then the neurofibril tangles start to accumulate in the brain cells, lead to neuroinflammation and cell death. These plaques and tangles lead to death of the cell, and these start in the hippocampus, which important for the memory, and spread all over the brain later on. Over the time, the brain getting shrunk and nerve become less connected, and the result of decline of the cognitive function and memory. The causes and risk factors, we have modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factor, like the age and amyloid beta accumulation, tau accumulation, and gene mutation. Cardiovascular could be modifiable, and unhealthy sleep could be also modifiable. Also adding to this, the sedentary lifestyle is progressing the risk factor to progress the Alzheimer's disease, while the exercises shown in the studies that to delay the delaying factor of the disease, and these factors could influence the rate of progression and the severity of the symptoms of Alzheimer's disease. As been mentioned in the Alzheimer's Association, that the signs of symptoms will be the memory loss, planning problem, solving and challenge, difficulty completing familiar task, confusion, trouble understanding visual and spatial relation, and problems with words and speaking and writing, misplacing things and losing the ability to trace steps, decreased judgment, withdrawal from the work or from the social activities, change in the mood and personality. I would like also to add, as the study shown that there are some physical signs and symptoms like gait speed and balance will be affected in addition to muscle strength with Alzheimer's disease comparing to the similar age group. The stages of the Alzheimer's disease is the early stage, which happen before the 65. Patient will be independent in his life, but he lose some of his memory and forgetting some of everyday activity memory. In moderate stage, this will take longer time as the stage. It's 65 and above. Patient might remember significant details about their life, but greater difficult performing the task in this stage, and have more trouble in communication, experience modern behavior, and trouble with activity of daily living. In the severe stage, more neuron will destroy the brain and function, and patient will lose the ability to respond to the environment, to have a conversation, or to control the movement. And also in this stage, patient might get a bit bound. I would like to highlight the neuroplasticity in general. In general, that neuroplasticity, that the ability of the brain to learn a new activity or a new challenged activity. As a degenerative nature of the Alzheimer's disease, the ability of the brain to compensate will be significantly impaired. However, preservation of certain function as a neuroplasticity mechanism of Alzheimer's disease give the chance of the brain to have more change and more adapt to the disease. As example, being mentioned in studies that the exercises associated with Alzheimer's disease showed that some increase in the neurogenesis and angiogenesis that generating the new neuron in the brain and the blood vessels, growth of blood vessels, also production of the BDNF and other growth factor that helps to generate new neurons. And the idea of this, like when you are in a traffic jam and you are trying to take another road to reach the target. Physical activity beneficial for the elderly as it's decreasing the mortality and making greater healthy aging, and it's improving the fitness and flexibility, improve the muscle strength and mobility for the elderly population, improve the daily function, maintain the independency, and reduce the risk of fall and fall-related injuries. And physical exercises or physical therapy exercises that it's recommended for elderly going in the aerobic exercises to improve the cardiovascular fitness and to maintain the healthy weight, and the resistance exercises to maintain and improve the muscle strength, which is reflect on the risk of fall, and also balance exercises to improve the balance and reduce the risk of fall, as been mentioned in studies that it has relation between the Alzheimer's disease and decreasing the balance. Also, other exercises like functional training or gait training. Sit to stand is important exercise for elderly people, and I think it will be helpful for patients with Alzheimer's. Stretching to improve the flexibility and range of motion. Recent study 2022 studied the effectiveness of physical exercise in Alzheimer's disease. In a systematic review of 8 articles, they found the effectiveness of physical exercise in Alzheimer's diseases patient, and found that moderate to limited evidence that aerobic exercises on its own or combined with a multimodal program including the strength and balance exercise, can be useful tool to manage the Alzheimer's patient in order to maintain or improve physical function capacity and cognitive performance. Also found that aerobic physical exercise could reduce the neuropsychiatric symptoms and improve the quality of life of Alzheimer's disease. They also came up by general recommendation of at least 9 weeks of minimum of 2 sessions weekly, at least 30 minutes per session with moderate intensity of exercise can be required for physical function capacity and cognitive performance with Alzheimer's disease. Also, systematic review and meta-analysis on physical activity to improve cognition and activity of daily living in adults with Alzheimer's disease 2021 showed that the pooled data showed that it's weighing for physical activity and coming up by support of the aerobic exercises and mixed exercises is beneficial for global cognition and activity of daily living with Alzheimer's disease. Other methods could be added to patient and elderly, could help also in Alzheimer's disease, like dancing, Tai Chi, and yoga to improve the balance, flexibility, muscle strength, and cardiovascular fitness. American College of Sport Medicine and American Heart Association recommended to promote the cardiovascular fitness and prevent chronic diseases to have in the program aerobic exercises of minimum of 150 minutes of moderate intensity per week, or 75 minutes of vigorous aerobic exercises per week, in addition to strength exercises and balance exercises of 2 to 3 times per week, will be helpful for the cardiovascular fitness and prevent chronic diseases. These are recommended physical exercises and other exercises for dementia and Alzheimer's disease. As you can see as example, it could be prescribed for Alzheimer's disease patient, as in the first thing, the aerobic exercise like brisk walking, cycling, or swimming will be beneficial. Also, the social engagement as well will promote social interaction, cognitive stimulation, reduction feeling of isolation and loneliness. However, some contraindication with this population, with elderly people with 65 years old, could be contraindicated and stop us to go to that level, such as cardiac condition with patients who have low ejection fraction, or some COPD with the chronic diseases, or other diseases, need to be consultant the specialized physical therapist to have a specific program for those kind of people and give the prescription of the program. An early stage, as examples for the exercises for elderly people, to have some aerobic exercises, resistance training exercises, and balance exercises in order to promote healthy lifestyle and to prevent the risk factor of Alzheimer's disease, and focus to improve the activity to promote neuroplasticity and neurogenesis, strengthening and balance for those kind of patients. In mild stage, when the progression of the disease comes, so some of example of transferring technique, gait training, using of assistive devices, or some environmental modification to decrease the risk of fall for those kind of patients will help these kind of patients in this stage, and to have the functional activity of their living safely, and fall prevention exercises to be given. In the later stage, intervention used to maintain the patient functional ability and reduce the risk of fall, promoting the comfort and providing stimulating the environment. Intervention will to promote exercise or maintain the function, exercise to maintain the range of motion, comfort, and reduce the pain. Example like chair exercises to give less effort for those kind of patient in this stage to have some benefit, and passive range of motion or stretching. And thank you.